So I have a couple medical students that are observing us today, so I'm going to use a little bit of medical ease as we talk, so I hope that doesn't bother you. And I'm just going to review for them what your vital signs were.
Okay.
So your blood pressure was 120/80, your pulse was 80, your respiratory rate was 18, which was very slightly elevated. Your temperature was 98.8, and your oxygen level in your blood was 95%, and that was just breathing regular room air, so that's very good. Okay? So, as you can see, she looks like she's a very well-developed female. She's well-nourished. She does not appear to have any labored breathing when I watch her breathing pattern. And you can always just lower the gown a little bit in front to take a look at, make sure she doesn't have any retractions. And you could likewise raise the gown from below to look for that. So she's breathing comfortably. And then I'm simply going to look at her nail beds, and she doesn't have any signs of clubbing or cyanosis. Can you open your mouth and put the tongue to the roof of your mouth? Good, thank you so much. And she doesn't have any signs of central cyanosis either. Okay? So the first thing I'm going to do is I'm going to press on your chest, and I want you to tell me if it hurts anywhere.
No.
So I'm pressing on both the front and the back of her chest simultaneously.
No.
Okay. No tenderness when I do that either. Okay. So now what I'm going to ask you to do, if you wouldn't mind, is turn your back to me. Okay. Now, the first thing I'm going to do is I'm going to have you take a deep breath in. Excellent, let it out. Very good. I'm going to have you say the words toy boat every time I put my hands on you.
Toy boat. Toy boat. Toy boat. Toy boat.
Great. I'm going to tap a little bit on your back. Okay. Now what I noticed when I was doing that is that she was ever so slightly hyper-resonant to percussion, and that is a common finding in patients who are hyperinflated with asthma. And I also noticed when I did her tactile fremitus that her vibrations were slightly decreased, and we see that when people are hyperinflated. The next thing I'm going to do is I'm going to listen. I'd like you to take nice deep breaths in and out through an open mouth. And Mrs. Zink, I'd like you to just tell me if you're feeling at all dizzy as you do that. Sometimes making you take these deep breaths, you hyperventilate a little bit, and I don't want you to get dizzy and pass out on me. I don't want to pinch you. Excellent. Okay, now what I'm going to do, I'm going to move around to the front. I'm going to have you lay down for me. You'll be more comfortable if I pull this out.
Thank you.
Okay, and I'm just going to loosen this up and pull this down a little bit in the front. Okay. Now I'm sort of going to do the same thing on the front that I did on the back. So can you please say toy boat?
Toy boat.
And again, those diminished vibrations and a little bit hyper-resonant to percussion. Now as I listen to her chest throughout both the posterior and anterior and lateral lung fields, I'm hearing that she has a slightly prolonged expiratory phase. and that she has scattered wheezes throughout. So Mrs. Zink, what I'm going to have you do is I'm going to raise your gown to here, and I'm going to have you very slightly just lift your breasts up for me. Got to get that just a little higher. And take a deep breath in and out. Excellent. Now I'm going to just do that tapping again. And I'd like you to say toy boat.
Toy boat.
Excellent. You can go ahead and bring your gown down. And we are all set. So I'm going to help you sit up here. Now, it certainly seems as though this is an asthma exacerbation. You sort of knew that coming into the office today.
Right, I did.
So what I'm going to do is I'm going to start you on some prednisone. We're going to put you on that for 5 days.
Okay.
And then I'm going to get you restarted on that Advair inhaler as well. Okay? It's been a pleasure meeting you, and I hope we can get you back on your feet and back enjoying those things that you like.
I appreciate it.
Okay.